Come in.
Hi, good afternoon.
Good afternoon.
My name is Maggie. I'm going to be your nurse for today. How are you?
I'm good.
Good. Alright. So, before I start, can I get your full name and your date of birth?
Yeah, my name is Phyllis McCracken. I was born March 17th, XX.
Okay, looks like it matches with your badge. So, it looks like I have an order to put a NG tube. It's a nasogastric tube. It goes in through your nose. Looks like it's because you're having a little bit of stomach issues.
Yeah, I've been kind of throwing up.
Oh, okay. Sorry about that. Hopefully this helps resolve some of your issues. Let me just go ahead and sit you up a little bit, okay?
Okay.
Alright. It looks like you also have an IV in place. I'm just gonna go ahead and take a quick look at that, okay?
Okay.
Alright. So it looks like you're at 42 mLs per hour, which is what the doctor ordered for you. So let's see. IV looks intact. I don't see any swelling, any discharge coming out. I'm just gonna go ahead and feel with my wrist just to see how your temperature is. Okay, it feels the same as the rest. I'm gonna go ahead and check the tubing for any kinks. It looks good so far. Alright, and the rate looks consistent. Okay, so everything looks all good. Do you feel any type of pain around your IV site?
No?
No? Okay. So I'm just gonna go ahead and palpate a little bit. Let me just get some gloves on. Just to keep everything clean. So I'm just going to press lightly around the area and you let me know if you feel any discomfort, okay?
Okay.
Any chills or anything?
No.
Okay. It seems puffy. Alright. Since you do have an IV, I'm going to go ahead and just check your lower legs just to see if there's any fluid buildup, okay?
Okay.
Alright. Just gonna uncover you for a little bit. Okay. Legs look good size. There's no pitting. No signs of edema on either leg. So I'm checking for capillary refills. Less than 2 seconds. Okay, lower legs look good. I'm gonna cover you back up. Alright. So since you do have an IV, I am going to go ahead and just take a listen to your lungs. Is that okay with you?
Yeah, that's fine.
Okay, I'm going to be listening under your gown. And then we're just gonna make sure there isn't anything that signals any fluid in your lungs, alright? Just a couple deep breaths. Alright, can you take a deep breath? Okay, one more. Go a little bit lower. And last time. Okay, lungs sound clear in the front. But pneumonia does show up best in the back, so I'm just gonna go ahead and help you lift up. Take a listen to your lung sounds through the back. And then I'm just gonna have you same thing. Deep breaths. It might feel a little bit cold. Deep breath. Again. Alright, let's see. And the last one. Perfect. Let's cover you back up, lower you back down. Okay. So lungs sound cleared on both sides. Nothing that would indicate any fluid overload. Okay, so I am going to go ahead and start kind of prepping you for the NG2. So it should not hurt. However, because it is going in through your nose and down through your esophagus, it might feel a little bit uncomfortable. Some people gag. People might throw up a little bit, but that is completely normal, so don't feel bad. Let me just take a look at your abdomen. Okay, so I see some distension a little bit. Okay, so before I palpate, I'm just gonna go ahead and take a listen, okay?
Okay.
Okay, I see. Yeah, it does sound like you have hyperactive bowel sounds. So I'm gonna go ahead and just palpate, okay? You let me know if you feel any pain. Alright. Okay, so you do have hyperactive bowel sounds. I'm gonna go ahead and lift you up a little bit more just to ease the NG tube going in, okay?
Okay.
Alright. So I'm gonna place this just to keep you as clean as possible in case if you are to throw up. I'm going to give you this basin. And then while I'm inserting it, you are going to have to drink some water, okay? Just to ease the process for both you and me, just to get it over as quickly as possible. Alright, let me just go ahead and get my tape ready just so we don't struggle as much. Before we start. Okay, so it looks like you are to be set at continuous irrigation. So let me just go ahead and turn it on. It's continuous. I have to make sure it's in the low. I'm just gonna go ahead. Alright. Good. I'm gonna place this at your side just to connect it once we finish. Alright. So I'm gonna start off first by just measuring the two just to see how far down we have to go. We start at the tip of your nose and then we go behind your ear, under your chin. Similar process, and it looks like you are going to be at around 60. Okay. All right, so I'm gonna just go ahead and prep my tube just to ease it, and I'm just gonna go ahead and help you do chin to neck just to make it easier, and then I'll let you know when to drink water, okay? All right, here we go. Drink. Drink. All right, keep drinking. We're just gonna keep pushing. I know, I'm sorry. Just keep drinking. Keep going. Almost there. Drink. Drink. Keep going. Almost there. Okay, looks like we're all done. Let me just go ahead and get my tape ready. All right, this is just to secure it in place, make sure it doesn't come back out so that we don't have to redo that process all over again. All right, so other one, other side, and then we should just need one more. Across. Okay, so that should keep it in place. All right, so I'm just going to go ahead and just I'm gonna go ahead and just pull out for stomach contents, okay, just to make sure we got it in the safe spot. Okay, Okay, yeah, looks normal. We look like it's bile. It's that greenish color. So I'm gonna push that back in. Okay. Again, how are you feeling?
I'm feeling. It was relief at first, but I don't know.
Not anymore.
Yeah, it's kind of. I don't know.
Oh,
Are you sure this thing working right?
looks to be, but you're right. I don't see as much content coming out. Your belly still looks a little bit distended. Okay, so what we can do is the doctor did think this through a little bit. So it looks like we do have an order to flush it with 60 mLs of normal saline. So I can go ahead and do that just to kind of help move everything around your stomach, flush it around, just to ease it out, okay? So I'm gonna go ahead and just something there. We are going to be doing 60 cc's of normal saline, okay? Alright. I'm just gonna go ahead and do this. Okay. You shouldn't feel this at all, okay?
Okay.
Alright, so we're gonna push in. Alright. Now we're just gonna push back out just to make sure that it stayed in place. Yep. Still looks like normal stomach contents. Take this off. Alright, and we're gonna go ahead and and how does that feel?
It feels better.
Better? Good. Alright, so I am going to go ahead and just clip this onto you. Just take those off. Alright, I'm going to go ahead and just put a safety pin to keep it stable with your gown, okay? Just so it doesn't move around as much. And then with this, you are set to be nothing by mouth, so you will not be able to have liquid or solid foods, unfortunately, until we receive an order to remove it. All right, and then I'm going to be standing this up. This is kind of just a burp tube, just for any air that's coming out. And then another thing, on top of not being able to have food by mouth, you are also not to be laying back down flat, just to prevent you from any choking or any throat getting stuck. So it's kind of just for your safety. But other than that, you should be all set, okay?
Okay.
All right, so I'm going to be coming back in about 30 minutes just to kind of check you once again, make sure everything's still being suctioned as normal, and if you feel like we need another flush with normal saline, I'll be more than happy to help you with that, okay?
All right.
All right, thank you, fellas. Have a good day.
Okay, thank you.